Hi, my name is Andrew Anderson. I am a research scientist at the National Committee for Quality Assurance. I was in Cohort 1 of Health Policy Research Scholars, and I am also a graduate of the University of Maryland College Park, where I studied health services research. My research focused on the social determinants of health and how they impact health disparities in the healthcare system. So we all know that the cost of healthcare is really high in this country. Medical care is bankrupting families. We are seeing constant threats of insolvency to some of our most essential programs like Medicare and Medicaid. But there's a lot of things driving the cost of care. One of them is this idea that patients and families, consumers, they don't really understand medical care in terms of what appropriate treatments are. They don't understand the cost of care, why at one hospital a procedure may be thousands of dollars and at another hospital it's a couple $100s. So medical care has historically been kind of a black box. And a lot of the research that I do is on kind of increasing transparency in the healthcare system in terms of cost and quality so that patients can make better decisions about their own treatment and understand their treatment options. Doctors can understand the optimal choices for their patients and use shared decision making to come up with good treatment options. Then policymakers can also know what the evidence base says around what incentives work to improve care, to reduce costs. So a lot of my research focuses on increasing that transparency so that we make better choices and better decisions in healthcare. So in 2001, there was this landmark report called Crossing the Quality Chasm. A lot of people are familiar with it. It was from the Institute of Medicine, which is now the National Academies of Medicine. And this report kind of highlighted the 6 aims for improving healthcare in the United States, and it included things like patient-centered care, making care effective, making it more affordable, timely. But one of the goals or aims that were often overlooked, I would say, is equity, right? So, and it's one of the harder issues to tackle because it's really about fairness and who gets to define fairness and what does fairness actually look like. And one of the ways that I describe it, at least in my research and the folks that I work with, is trying to eliminate disparities in the healthcare system. So we can't achieve equity without eliminating disparities. And we see disparities across a variety of issues. And you see racial and ethnic disparities, which are primarily driven by structural racism and a lot of the historical injustices that we have in the United States. You see disparities in the disability population where they're not getting the accommodations that they need. You see disparities because of course, socioeconomic status, which everyone is now kind of more familiar with, this wealth-health gradient, where you're seeing low-income individuals suffering worse health outcomes in the healthcare system. So there are a lot of issues around disparities in the system, and a lot of my work is kind of focusing on how do we eliminate those disparities? How do we say this is a problem, here are some solutions, and how do we take action on it? One of the more concrete examples around this is a lot of people don't know or aren't quite as aware of disparities in surgical care or in surgery. You think, surgeons have their checklist, they have their guidelines, they have routinized care. It's almost like an assembly line. But a lot of people don't know that, for example, racial and ethnic minorities are more likely to die on the table, die shortly after a procedure. They have a much higher accrued mortality rate. They also are more likely to suffer from complications. Blacks and Hispanics have double the rate of amputations related to diabetes complications, and often those amputations are more debilitating. So it's shocking, and it continues to persist. And one issue that we know that those exist. We know that there are interventions that can be used to address them, but hospitals don't routinely measure that this is happening. So a lot of this documentation has happened, through one-off reports, one-off research studies, but we have these really robust registries in surgery, but they don't capture this kind of information, and they're not monitoring it to make sure that we're seeing improvements over time. So kind of going back to, my research, it's kind of bringing that transparency, making sure that hospitals, health plans, health systems are identifying the problem and then using the evidence to address the problem. You need mentors, you need friends, you need other people around you for support if you're going to be trying to address big problems such as health equity. And so I think and I hope that I'll continue to stay connected to the individuals that I met through this program throughout the rest of my career.